Hey everyone, Dr. Tim Speicher here from the Positional Release Therapy Institute. I'd like to talk to you today about back pain. So who hasn't had back pain? I mean, most of us at one time in our life have had back pain, or about 90% of the population will at one time or another in their life. So how do we go about it that's different here in Ogden, Utah, and abroad than traditional therapy, chiropractic, physical therapy, massage, things of that nature? Well, we have to get down to the root of the problem. And I believe the root of most all back pain, both acute and chronic, is the anterior nominal rotation, the air. And so what is that? Well, take a look at the pelvis. Should be level. You can see it's pretty together. Both of these hip bones here that essentially connect or are chockstone by the sacrum, they actually rotate and should rotate like wheels. And what we have done over the last 20 some years is develop a protocol called the Wheelhouse Protocol to not only identify, do you have this error, this condition, but also how to treat it and resolve it typically within 1 to 3 sessions. So what happens when this thing slips out? Well, let's take a peek. So let's construct a pelvis here, and let's put this one together. And so here you've got, let's see if I can get it together. There we go. So here we got your pelvis. And something is going to shift you. It's going to rotate this one out. And I'm really a strong believer in that it's really an anterior rotation. That's pretty much it. Most people think, well, your hip went up and you shifted back. It's in relation to the anterior shift. The other side will shift back and up. And so what does that result in? Well, lots of pain. And so it varies for all kinds of individuals. It can be so debilitating, you can hardly move. Well, what happens back here is the sacrum, when this shifts down, the sacrum will shift with it. And what does it take along with it? Well, it takes your spine with it. And so when that hip shifts down, the spine will go and twist. That puts compression on your discs, your nerves. It stretches the sciatic nerve. The hip no longer shifts down. It actually will go this way. So therefore, your sciatic nerve gets stretched. You can have sciatica. You can have that dull pain at the low back, hiney area. Your nerves completely shut down on that side, particularly because the nerves that are coming out of the spine and going down your leg and innervating the muscles, they don't like to be stretched for a long period of time. And so this shift, this anterior nominal rotation, sets up a firestorm that results in tightness, mobility. Things just get locked neurologically. And so tissues that normally do this, they're now locked. They're locked down. It's like a dislocated joint. Well, basically it is a dislocated joint. The SI joint is dislocated. And all kinds of the other joints also go out of whack. So when this locks down, you can get cracked, it'll go right back. Cracked, right back. And you could stretch it, goes right back. And so we end up in this never-ending cycle of manipulation and stretching and exercises. Yes, we need those eventually, but the pelvis must come back into position. And so we do that by neurologically resetting those tissues, allowing them to free themselves so that the pelvis can shift back, and often it just shifts back by itself. No big tug, but often if it's been out a while, sure, we have to give it a little push. However, it's much more easy for the pelvis to shift back when it's not being held hostage neurologically. And it doesn't also set up as quickly in essentially getting stuck if we can do this treatment, pretty quickly. And so we advocate as a preventative measure to get checked. But also, if you're just having chronic low back pain, you're feeling locked, traditional therapies have not been effective. Positional release resets those neural tissues, brings blood flow to the low back and tissues, frees your sciatic nerve, frees your piriformis, and reestablishes normal homeostatic, normal tension, normal mobility, and also reduces pain. So come experience the Wheelhouse Protocol here in Ogden. Relieve your back pain today, not in 43 treatments, not in 12 sessions, but today. And so give us a call, and we look forward to seeing you here and for you to experience the Wheelhouse effect.